Hello, good morning everybody. My name is Alejandro. This morning we have the pleasure of being with Dr. Acuna. Dr. Acuna, you're the business owner of DPTSI and physical therapy. And we'd like to thank you for the opportunity of being with us for the interview section of my research paper. And if you could please go ahead and explain what the credentials mean behind your name.
Most definitely, Alejandro. Thank you for having me here today. Essentially, there's a long list of credentials behind my name, but that not only means that I work very hard to achieve different certifications, but I also owe a lot of money to different programs here because investing my time and money with that. But essentially, first and foremost, I'm a physical therapist. That's what the PT stands for. DPT means my level of education was up to a doctorate level, so I'm doctor of physical therapy. I also have some certifications in sports and orthopedic manual therapy. I'm one of the few certified sports and orthopedic manual therapists here in the Rio Grande Valley. That's what we focus on a lot, is sports-related therapy, albeit everything else is still part of physical therapy, but my concentration is in sports.
Okay.
I also have my running rehab specialist certification. I'm completing my fellowship training with IAR, which is the Institute for Athlete Regeneration. So right now my credentials show as a fit for fellowship and training, which I'll soon have the completion of the fellowship training here when I finish my mentorship hours.
Okay.
And then I'm also certified in dry needling as well as other certifications that I have.
Okay. All right. So we're gonna go ahead and get started with the interview section. And for the research paper topic, we have the effects of prolonged exercise and sports on aging. Now, as a therapist with many years of experience that has had the opportunity to work with multiple patients, tell me, what are some of the positive and negative effects of prolonged active lifestyle and functional capacity in the people that you have worked with?
Most definitely. So essentially, there's positive effects for movement and exercise, and there's also some negative effects. But I guess with this question, I just kind of went into just what does the positive effect of movement and what is of the active lifestyle, right? Essentially, you have better endurance, you have better strength, you have better stability, right? You have better balance, better proprioception, right? So persons of especially the elderly age, they move around better and they can perform different kinds of sports or activities that are more comfortable to their age-related, lifestyles. But you maintain that healthy lifestyle, less risk of injury. You definitely have a better outcome if you do injure yourself because you already have the established strength and stability within your musculoskeletal system.
Okay.
So those are all positive effects. Some negative effects is that, with increased lifestyle or increased sport-related activities, you kind of increase your risk for injury.
Yeah.
And so at that point, you can have like an ankle sprain or a knee sprain or hip fracture or something of that sort. So that's kind of a negative impact for it. But in all reality, there's not too many negative impacts in the lifestyle of elderly if you're active, right?
Okay. And now, unfortunately, there is a large population of elderly people that, because of one reason or another, they do not have an active lifestyle. Do you think that is it ever too late for elderly people to start an active lifestyle?
Yeah, most definitely, and it's not. It's not. I think just culturally in our area, it's very easy to have a sedentary lifestyle,
Yes.
right? What do we have here locally to help encourage elderly persons to be more active and get out there? There's not too many attractions, right? There's not too many things that are like, hey, get out there. Although we're slowly starting to improve that, but it's never too late. It's never too late to get healthy, right? It's never too late to move. Okay. What I have seen in my years of practice here is the sedentary lifestyle, the unhealthy, the diabetes, and all the other metabolic related type of changes in our elderly are really established because they just didn't have that education of how, or they may have tried years ago but never had the proper guidance, and so they essentially gave up, right? First and foremost, we're always going to suggest that you seek medical physicians to oversee, their advice on how or what you can and cannot do. Seek medical clinicians such as physical therapists that want to give advice on how to individualize programs, exercise programs for you, not give you cookie cutter or just kind of like things that you can find on Google for. It's not a one size fits all kind of exercise program, but yeah, essentially it's never too late to improve. Now, most of the time with us, like being physical therapists, we're considered movement specialists, right?
Yes.
And I tell patients all the time that movement is medicine. So essentially people want to say, well, give me a pill for that, or give me medicine for that, or give me this. It's like, hey, before you know it, you've got a whole concoction of medicines you have to take. I've had patients that do 30, 40 pills a day, right? And it's like, hey, we could just kind of get you exercising and moving and getting some changes within your body. You're going to notice that you don't need all these, medication and interventions of that sort. So I don't ever think it's too late to get started moving. Okay, it will always improve your body and the lifestyle you have. But I do suggest you always seek medical advice prior, especially if you have not had any of this for many years.
Okay. Okay, and lastly, from your experience, sir, doctor, what are some of the sports that have caused a greater impact, well, positively and negatively, in the way elderly people live?
Sure. Well, you can kind of always go back to question one about like what are the positive and negative effects of active lifestyles to really say, well, what sports impact positively, what sports impact negatively. The higher risk sports that get you, doing things that are requiring higher skills of balance and all that transitional stuff, yeah, that increases your risk of injury and all that, right? But in just general, talking about sports for the elderly, that's good. We have many patients that we've suggested to start, doing simple things such as chair yoga, chair volleyball, some Pilates type of stuff, Tai Chi. Those are things that are usually like a good beginner type of thing. For the more advanced client that says, I like movement and I like, and I want to feel the sweat and all that, we advise them to try like pickleball or to try, walking a golf course and playing golf, doing swimming, cycling, stuff of that sort, So there's all kinds of, speed walking on unlevel surfaces, whatever sport-related activity that you find that is good for the potential of the client, we always suggest. And of course, the positive impacts are just healthier lifestyle, it decrease your metabolic diseases, improve your heart rate and blood pressure and all that kind of stuff. Negative impacts is that, yeah, sometimes these individuals have that very sport athletic-like mentality, and they're like, well, I can do it because that 30-year-old did it, and then they end up injuring themselves or something of that sort. But nonetheless, hey, you come see a good, qualified, skilled physical therapist, and we can definitely help you get back on track. But yeah, generally speaking, it's just if you are thinking about what you want to do as far as like sports and activity to help improve your lifestyle, come see a movement specialist. We can tailor programs that essentially are good for functional mobility. And if we find that there's some deficits in balance or proprioception or stability or strength or endurance, then we can help tailor an individualized program to be something that you need to improve, right? Because if I've got a strong individual with great endurance, I may not be incorporating a treatment protocol or like an exercise regimen that's high on endurance and strength. I may want to improve on mobility or flexibility or stuff of that sort. So there's a lot of different ways of doing it, but ultimately seeking a movement specialist would be a great way to start.
All right. Okay, well, Dr. Acuna, we would like to thank you once again for giving us the opportunity to be with you this morning and for conducting the interview for my research paper. And we want to wish you the very best.
Thank you so much. Appreciate your time.
Thank you.